Now our next topic is acne rosacea. So rosacea means a redness, erythema or flushing, long-term continuous flushing of the blood, may termed as a rosacea. Now rosacea is a chronic skin disorder which is characterized by the erythema, telangiectasia along with that acute episode of papules, pustules and swelling. So what is erythema? Erythema means extreme redness. Telangiectasia means dilatation of blood vessels due to the intermittent or the continuous flushing or flow of the blood. Or along with that redness and telangiectasia, patient having the recurrent acute episode of papules, pustules and swelling.
So guys, from the term telangiectasia पे से कौन सी मेडिसिन आप सोच सकते हो? Anyone?
Belladonna.
Yes. क्यों belladonna? That is rush of blood.
Rush of blood.
Yeah. So when rush of blood is there on head, we can think of the remedy that is belladonna. And belladonna works excellently in cases of rosacea, as there is redness, there is inflammation. We can think of belladonna.
Now, etiology of acne rosacea. As acne vulgaris, here also the exact cause of acne rosacea is still unknown. But there are some mechanisms which explain the development of acne rosacea, like vascular abnormalities. So in this case, vessels are abnormally reactive to the certain stimuli. Increasing or exaggerating the flushing means increasing the blood flow towards the skin. So the certain stimuli like heat, spicy food, alcohol, or stress, they lead to the increasing the blood flow to the skin. And there is no pharmacological defect has been found, means there is no relation with the medicines which produce this kind of abnormality. Now the second mechanism is pathogenic organism. Some organism which causing the acne rosacea are found, like follicular mite and microaerophilic bacteria. Follicular mites are Demodex follicularum. It is a type of mite which are generally found on skin of a human being. They only survive on the human skin, otherwise they not survive. So all the human being, all the people having the Demodex follicularum on their skin, but they are harmless. They generally do not produce any harm to the patient or the person. But when increases their population or they colonize, so they causing the acne rosacea. So Demodex follicularum generally example of commensalism rather than the parasitism. Commensalism means Demodex follicularum is a mite and which is live on the surface of the human being. So they are benefited from the humans and the humans are not harmed, neither harmed or nor get benefit. So this is the example of commensalism. Whereas in parasitism, the parasite attached to the other species and they harm to that species and they get benefited from them. So that termed as a parasitism.
बचपन में जो एग्जांपल नहीं
हाँ सजीवी और
बफेलो और वो क्या था उसके ऊपर बगला वाला.
So this is also example of commensalism. Now microaerophilic, those microorganisms which are grow actively or grow more in the lower concentration of oxygen environment. They are generally not developed in normal saturation of oxygen. So the example are Helicobacter pylori. They are generally found in stomach. But they are also causing the acne rosacea.
So in cases of acne rosacea, I have many times seen that the dermatologists are checking for H. pylori in stomach. So I don't know why they were doing such thing, if it is connected or not, but I have seen many patients, even they are checking H. pylori in cases of alopecia areata. Right?
Now, epidemiology wise, age are mostly the fourth or fifth decade, means 40 or 50 years are more prone to develop the acne rosacea. And gender wise, female are more frequently involved than males. Clinical feature, first of all, triggering factor, which increasing the blood flow to the skin are emotional stress, hot drinks, spicy food, alcohol, or withdrawal steroids. Whenever the steroids are withdrawn, they causing the rebound redness. Morphology wise, morphology wise, first of all, the erythema and telangiectasia. First of all, the erythema is developed. Erythema is also a kind of intermittent flow of blood is followed by the permanent erythema and telangiectasia. Means firstly the flow of the blood are intermittently increased, and after that the permanently blood vessels are dilated, the connective tissue underneath the blood vessels are damaged, and due to that the permanent telangiectasia and permanent erythema are developed on the skin. Now papules and pustules. Generally papules and pustules are discretely present, means they are far away from each other. They do not having any comedons at all on the skin, and somewhat they having the dryness of the skin, and the background having the erythema, means extreme redness and extreme telangiectasia is the diagnostic feature of acne rosacea. Here you can see the redness. There is no eruptions, means it is early stage of acne rosacea.
First formation is not yet found.
Here is the second case. You can see the monomorphic appearance, means the eruptions are look alike, some having the pustules. So it is acute attack or acute episode of papules and pustules. Involvement of nose, you can see the redness and multiple open pores on the nose.
कौन सी मेडिसिन दोगे? Acne or boil on tip of nose, guys.
Causticum.
Yes. The remedy is caustic.
Yes. So more prone site for the development of acne rosacea are centrifacial, means the cheek, chin, and forehead are involved, or those area which having the convexity on a face, but except the periorbital and perioral areas. These two areas are spare. So the forehead involved, cheek and chin are involved, but the periorbital area and perioral area never involved in acne rosacea.
जनरली ये चार जगह पे होता है, that is on cheeks, on forehead, and below the lip. These are the common site. When there is acne below the lip, guys, over here, if it is there, think of viola T. This is the specific remedy when there is acne below the lip or an eruption below the lip over here or chin.
The course of development of acne rosacea in early disease, only the flushing, means increasing the blood flow towards the skin, mild edema and mild telangiectasia is seen. In progressive disease, the pustules, papules, and sustained edema remain for a longer time, and extensive telangiectasia are seen in progressive disease. In the late disease, induration and rhinopyema is developed. What is rhinopyema? We will discuss in complication. Now, the complication of acne rosacea is ophthalmic complication, blepharitis, conjunctivitis, and keratitis. They may involve the inflammation of eyelid, that is blepharitis, involvement of conjunctiva inflammation, that is conjunctivitis, and when cornea is involved, it's called as keratitis. Now, rhinopyema. Rhino means nose. So in extreme cases of acne rosacea, nose is involved. Nose become large, having the multiple pores on nose, and due to that hyperplasia of sebaceous gland, nose become enlarged. And lymphedema, infraorbital and forehead having some kind of edema. Now the diagnosis. So the diagnostic criteria for acne rosacea is generally seen in middle-aged women who are at her 30s or 40s. Episode of flushing and intolerance of heat and spicy food. The background of skin having the extreme redness and telangiectasia, or some having the acute episodes of papules and pustules. There is no at all comedons on the skin. Convexity of the face is involved, like forehead, nose, cheek, and chin. and characteristic are the sparing of periorbital and perioral area. Now the differential diagnosis. Acne vulgaris and acne rosacea, as we differentiated in previous slide. Now the seborrheic dermatitis and rosacea. Seborrheic dermatitis involve the follicular papules, having the follicular papules with the greasy and loose scales, means the having the oily skin and having the some scaling on the face. Whereas in acne rosacea, having the redness, pustules, and telangiectasia.
Here scaling is missing in cases of rosacea. अब eruptions हो गए, those are red, those are pustules, they are with severe redness. लेकिन if the scalings are there, then we can think of seborrheic dermatitis. आपके पास बहुत सारे पेशेंट आएंगे, इवन मेल पेशेंट जिसको मस्टाच के अंदर की पोर्शन में भी स्केलिंग रहता है, that might be seborrheic dermatitis.
In seborrheic dermatitis, the skin is greasy and oily. In acne rosacea, erythema and telangiectasia means redness, extreme redness is seen.
Greasiness is seen in acne vulgaris rather than rosacea.
Distribution on eyebrows, eyelashes, nasolabial fold, retroauricular region, and scalp. Whereas the acne rosacea is centrifacial, means forehead, cheek, nose, and chin are involved. Here is a case of seborrheic dermatitis. You can see the you can see the yellowish scaling on the scalp, retroauricular involvement. Here you can see the loose scaling on nasal fold, and eyebrows having some loose scaling, and back in the back you can see the red eruptions.
So dandruff on eyebrows, कौन सी medicine दोगे guys?
Sorry.
Dandruff on eyebrows. बहुत सारे पेशेंट आएंगे, seborrheic dermatitis और dandruff on eyebrows. Anyone? Anyone guys? We are frequently using remedy that is saniculia, and another remedy we are using that is selenium. These two remedy we are frequently using for such condition, and that helps. दूसरी कौन सी है?
Seneca, Senicula,
Seneca, Senicula,
Selenium and Graphitis.
3 S और एक ग्रेफाइटिस,
और इसमें सल्फर भी दिखा है।
और पटरी के अंदर सल्फर भी है. We are frequently using Senicula and selenium, that helps.